Hello. Hi, and welcome to our True Facebook Live. I am Dr. Celia Egan, and as always, I have my partner and our gynecologist, Dr. Bitner.
Hello, I'm having a little technical difficulties, so Celia, if you want to get started, that'd be great.
Yeah, so tonight, because February is the month of love for our partners, we are going to talk about something that, some doctors feel a little shaky about talking about, sexual health. We love talking about it at True Women's Health because we believe that every woman deserves, an avenue to sexual health, whatever that may be for them. And so that's what we're going to talk about today is maybe how we brainstorm around, we're going to figure out our goals for our sexual health and ways that we can overcome some barriers to reaching those goals.
Yeah, I mean, as a gynecologist, hello everyone, Dr. Diana Bitner, True Women's Health. As a gynecologist, this also always used to be a really difficult subject to discuss. Patients wouldn't want to bring it up. We didn't know how to bring it up, and we now know that 80% of women have sexual health concerns, but only about 20% of women will bring it up with their providers, and only about 20% of docs even know how to talk about it or are comfortable talking about it. So years ago, I wouldn't have been comfortable having this conversation because I didn't know anything about it. I didn't know how to help women. And so I joke that as docs, we don't like to talk about stuff that we don't know about because we like to fix stuff. So here we are. We both learned a lot. We have a huge interest in this, and I really look forward to this conversation.
Yeah, and we just want to let everyone know that you definitely, if you have a question, that please feel free to put a question into the chat. We were talking with our team and, we realized that some people may not feel comfortable putting questions in, that you could actually direct message us on the Facebook Live, and someone will be watching that if you want to get your anonymous question answered tonight. So
That's
we're
right.
really excited to answer questions for everybody.
Yeah. And also, I mean, again, I understand that you might be shy to have your name on the screen and all of that, but you know what? The more we talk about this, the more we normalize this, it just gets easier to talk about. Mm-hmm. And I'm just fascinated. The more I learn about sexual health in the sense of it really relates to people's sense of well-being. It has a big impact on quality of life. It's not just about preventing sexually transmitted diseases or sexual illness. It's about, it's about a sense of well-being, and it also reflects one's overall well-being and health.
Absolutely. And I think, we've had a couple of other talks that people can listen to kind of overlapping the world of sexual health and metabolic health. And we may touch on that a bit. But it's just amazing how your sexual health is such a window into your overall health.
Right. And so we care about this so much because we don't want women to suffer. We want to reach as many women as possible with all things sexual health. But also, we just want to make it comfortable to talk about. Again, we want to normalize this.
Yeah. And one of my favorite things, since joining True is I'll be sitting in an office visit and we'll be talking about so many different things. And a woman will start talking about sexual health and maybe trying to overcome some barriers. And they'll say, "Oh my God, I can't believe I'm talking about this." And I'm like, I know, I love it, right? Like that you're feeling so excited to talk about this with your doctor and that we're getting your life moving in the right direction.
I know. And it's almost like opening Pandora's box because once people feel a little bit comfortable, it's like all of a sudden, all this stuff from years and years come out. It might be about upbringing. It might be about, religious beliefs and chastity culture and all of that. It might be just fear. A lot of women with sexual health concerns feel very isolated. They feel shame. They feel like they're the only one affected by these things. But all of you listening, I can't tell you, you're normal. It's okay. All these factors affect how you might feel about it, but your concerns are probably way more common than you would think.
Mm-hmm. And I think, we talk a lot about young people and being influenced by social media and, things that we see on the internet. And we forget that even ourselves, we may be influenced, right? We sometimes see social media posts where it feels like everyone's having this robust, amazing sex life and that, all these women kind of have it put together and maybe that's where they're at. But the truth is that there's a lot of women who struggle with many different aspects of what's preventing them from having an optimal sexual life for them.
Exactly. And we think about these things like biology, we think about psychosocial, we think about relationships, we think about, metabolic health and all the things. So it's like, it's a really complicated field, and it's fun when, once there's a basic understanding, we can then personalize it. Like for you, how does this apply to you? And, we want to talk about sexual health in terms of your comfort to be intimate, to be vulnerable. I mean, sexual health, even with just yourself or with a partner, is, there's no more vulnerable time, right? So it's about self-image. It's about, and then even to bring in women who suffer from cancer, from breast cancer, gynecologic cancer, cervical, uterine, ovarian, all of these things really interact and interplay.
Yeah. And I think it's so amazing when we're going to review a couple of cards from our sex deck that Dr. Bitner came up with to sort of use as a guide to help women, and honestly physicians, right, go through the different reasons and barriers that can prevent women from having any person, honestly, from having an optimal sex life. But I just think it's so interesting how there's just so many little pockets. And in some ways, I find there's a lot of overlap with obesity medicine in a way that there's a psychological component, there's a relationship component, and then obviously there's a biologic component as well.
Yeah, it all intertwines. And, at True, we use the clinical process called Waypoints, which stands for WAI, who am I? Our goal is that people reach their goal. They reach their goal in terms of what they care about, maybe at a milestone event, or just a lot of women just say, moving forward, I want to feel like my best self. So these are the 10 areas of sexual health. They all impact sexual health, but of overall health. And so we start with, the ability to be active, body composition. Again, this all affects sexual health, cancer, whether someone is at risk for or has been affected by cancer, diabetes. We'll talk about metabolic health and sexual health, ease of coping, phase of ovarian function, bones, heart, income, and then X for sexual health. And so we've recently added sexual health and called this out because it deserves its separate category. Celia, this was your brilliant idea. It was sort of buried in F, and I appreciate you saying, hey, why don't we have X, sexual health?
Yeah, I remember
talk about what your aha moment was with that.
Yeah. So, I remember looking through, working through Waypoints F with women and thinking so much about different aspects of their hormones. And then I felt like we were kind of rushing through the sexual health aspect of F. And I was like, wait a minute, I feel like this needs to be like a whole separate visit. And I think too, which I don't think a lot of physicians even know, that there's actually several drugs that are available to help a woman who has hypoactive sexuality desire disorder, or HSDD. And I think that, just having a platform to say, as new drugs come into them, are available for patients that are deemed safe, and then just even optimizing the drugs that are available now, I think is really imperative.
Exactly. And in each category, what we do again is we help women with their goal setting. So this is goal-directed care in the sense of, making the statement that you can read, sexual health is a vital component of overall health. It's affected by upbringing, metabolic health, habits, and mental well-being. It's about being at ease with expression and identity. It's having the confidence and ability to enjoy intimacy and pleasure with its spiritual, physical, emotional, and psychological aspects. And having said that, that's the statement. But then the goal is, how do you picture yourself? And we think about that in a 3, meaning very low risk. So again, this is more details of that picture of self. How do you feel when sexual satisfaction is reached? And that can mean that you're not sexually active and you're okay with that.
Absolutely. Right. I think one thing we don't want the message to be is that you have to have sex, right? Exactly. That is not the message. That is not, maybe we hear some husbands like applauding in the background being like, yes, listen to this, right? Sorry, this does not mean that you have to have sex. It just means that you feel satisfied with where you're at.
Exactly. And yeah, what feels natural and correct for you? Again, physically, emotionally, psychologically. And again, there's barriers, right? So we talk about those barriers that affect our ability to be sexually satisfied or have that sex life that we want. And so then we set goals. And so a 3 means you're comfortable and confident in your sexual health. 2, you have moderate challenges, but it's not really affecting the quality of your life. You might want to be a 3, you might not. So it's, again, first of all, deciding, what do you want? And 1 means you're having distress that affects your moods, your relationship, or your self-worth, or your overall health.
And why we chose, I think, Doctor, we can explain a little bit of how we sort of got there. Even when we were talking about being comfortable and confident, and we were sort of going through a couple of different scenarios that we hear of, and we were thinking, what about the couple who maybe has to travel a lot for work? And, when they see each other, they're totally in the right space and it works for them. But when they're apart, obviously they're not maybe having as much, sexual intimacy as they'd like, because they're literally physically apart, but they're okay with that. And they feel totally fine with where that's at. And they would still be a 3, even though maybe they want a little bit more, but they understand that there's a really manageable barrier that's in the middle.
Right. And so then again, it's really thinking about what's right for you. Having said this, we think about what are the issues that can affect. And we think about, number 1, there might be lower desire. Now, you might have low desire, and again, you're okay with that. You're comfortable and confident in your sexual health and having low desire. But let's say that you have good desire, but you have difficulty with arousal, or you have difficulty with orgasm. It's a little controversial which one comes first, the chicken or the egg. Is it that the desire is low and therefore there's not arousal? Is there arousal but then not desire? But it's really, there are issues that can affect any one of those 3. And then there's also issues of pain. There's issues of hormone changes that affect all 3 of these things, and the pain that affects that. So
people sometimes forget, a lot of times there's actually medications maybe you're taking for another reason that can change your desire or your ability to have an orgasm.
Exactly. And so then we think about, what are those tools that we can use to address this? So one tool that we use to affect the question of desire is the sex deck. So the sex deck looks at the 27 reasons for low desire. And these reasons vary by either psychological, by physical, or interrelationship. And now I came up with the sex deck because I would hear my colleagues talk and give great lectures at the International Society for the Study of Women's Sexual Health, or ISWISH. And I would be like, how am I going to remember all these? And so, having said this, we use the sex deck to be able to facilitate that conversation between ourselves, other healthcare providers, and yourself, to really go through these cards. So, for example, if someone comes in and says to our nurse, or they've checked the box, that, hey, my sexual desire is low, or I have issues about questions with sexual health, then we'll have the patient go through the deck and pick the cards that might apply to them. Now, someone might not know if low testosterone affects them, but they're like, well, maybe I'm in perimenopause. I heard that testosterone can be an issue. I'm going to pick this card. On the front of the card is the reason. On the back of the card is why you might have low testosterone. For example, a 30-year-old taking the oral birth control pill, her free testosterone levels are going to be low, and that can really affect desire. It can affect ability to become aroused. It can affect the ability to have an orgasm. And so it's looking at that and saying, what are the options? Can we change birth control method? For a woman who's in menopause, could we add a testosterone supplement, and would that be helpful?
I think a lot of this is so important because our women are just so busy in their lives doing so many other amazing things that you may not put it together. Like that moment that a couple weeks after you started your new oral birth control pill, that your sort of desire went down. And then we sort of put a lot of that on ourselves. Like, what am I doing wrong in my life that all of a sudden or what's going on with my relationship that, all of a sudden I don't want to have sex anymore, but really it's something chemical that just needs to be evaluated.
Right.
Maybe very easy to change.
And that's why these cards are so fun, is that we can go through these and we say, okay, for example, do I have difficulty achieving orgasm? So if that's so, here are the causes. Could it be just lack of knowledge? We ask women, and we want t-shirts that say, are you in the 30% club? Right. Only 30% of women can have an orgasm with penetration. And so if you're not in that 30% club, and you didn't know that, you might think something is wrong with you, or you're not fully connected to your partner, or you're not trying hard enough. Recently, I had a patient who said, I'm not trying hard enough. I'm not doing something right. I'm not like, no, only 30% of women can have orgasm with penetration. Do you have pain? You can't have pain and pleasure at the same time. Again, we could spend a lot of time on each one of these cards, but what's again so satisfying as, being able to help is then offering this information. Again, a woman goes through the cards, she might think, is there something wrong with my relationship? So we go through and look at all the interpersonal reasons. Do I have insufficient intimacy? Well, no, I really like hanging out with my partner. I feel like, it's really comfortable. We have fun together. We remember why we, got together. But we get to the card that says communication. Yeah, maybe I can't communicate right. Not communicate right, but communicate in the way that I'm comfortable. Or maybe my partner is afraid to talk about sex and communication is difficult.
I just want to pause there just for a second, because we forget how sensitive the topic of sex can be. A lot of our egos are very much wrapped up into how are we performing? How does my partner feel that they're sexually satisfied? And it can be a really tough conversation to have, kind of face to face. Particularly, I know in reading a lot about this, men don't necessarily love to have an eye-to-eye conversation about this. And they do better, honestly, laying in bed where their eyes are actually not staring at one another, but actually looking up, because you're kind of bringing up some sensitive stuff that may not feel good to someone's ego. And a lot of the times it is spending some extra time of finding the right words to use in order to just calm sort of the tone that's there. And even, like I said, the right position of maybe not necessarily staring someone in the face, but trying to find the right place where you both feel comfortable being there. As someone who actually, I've taken care of a lot of men and I've talked to them about their sexual health. And I remember the word that men would use again and again was, I just want to connect. It wasn't they wanted to get off. It wasn't they just wanted to have sex just to get it on and over with. They really wanted to connect with their partner. And so I do think a lot of men are there where they want to connect and it's just fun. And you want to connect as a woman with your partner. And it's just finding the right place.
Right. And sometimes women will say, well, guys, they just want the physical. I'm like, actually, no. If we survey them without their partners present, the surveys say, it's my way that I connect with my partner. I know my wife loves me, speaking heterosexual. I know my wife loves me if she has sex with me, because that's the thing she does with only me. She's taking care of the kids. She's taking care of her parents. She's taking care of my parents. She's taking care of the house. Like all of that. Yeah, that's what she does. But yet the only time we really connect is when we're together having sex. And, the next thing I go to is, what is sex, right? Sex is intimacy and pleasure. It doesn't have to be penetration. And talking with a patient the other day, she and her partner, they both have physical limitations. He's gained weight. She has pain. There's difficulty having an orgasm. She has cardiovascular disease. There's a lot of things that impact their ability to have penetration and have orgasm at the same time. And again, we backed up and said, what is sex? Now, if penetration is really important to him, but not to her, again, that's to have a conversation. So this card can be really helpful. It takes away the blame game, right? It just puts it on the open that this is a thing. And so recently a patient was so excited to take the sex deck home because she said, I want him to see that this is a thing. It's not just that I don't like him or I don't love him or I want to be with somebody else or I'm not turned on. Like, it's a thing. There's lots of issues here. And this is a way to go through it.
Yeah. And I love on, using some words to start the conversation with, I know this is difficult, but I care. Right. And just reminding your partner that you're there to connect with them.
Right.
I think one of the things on there that is at the bottom of this sex deck, which is reading erotica together. One of that leads into sort of a thing that I hear very much, which is women will talk about their minds are just spinning, right? With all the different things that they have to do through the day. They're all, they're anxious about their kids and work and parents and all these different things, that even taking a period of time, knowing that, you want to connect, to refocus even on your own body. And I love when people read erotica because it's just getting that mind refocused back on what the task is at hand. and then getting the mind ready for kind of that next step and kind of gearing up the brain to move from, our life's check boxes into you and your sexual pleasure. It's just that little bit of movement from a little bit of space in between.
Yeah. And a lot of people too, a lot of women, even recently, it seems more common, like people say, I have vaginal dryness. And so we go through the different reasons for vaginal dryness, and it might be, sure, it's postmenopause and low estrogen. Certainly that's a cause. But the last couple of women who asked me about this, they're in their 30s. And I'll say, are you busy? Well, yeah, I have kids, I have a job, I have all the things. Vaginal dryness can be caused by just lack of arousal. So one way we measure arousal is by lack of dryness. It's that ability to produce lubrication. And so, women are like, so many thoughts in my head. So it can take 30 minutes for a woman to become aroused, even when everything is perfect. Relationship is good, time and space, there's a good lock on the door, it's Sunday morning and the kids aren't awake yet, everything is okay, but it can take 30 minutes, whereas a guy might take 30 seconds, right? And so it takes 30 minutes. And so, for example, one of the tricks is to initiate sex when you're rested, when you're not distracted, when maybe you've read some erotica, you've had some thoughts, and then, you're starting to feel aroused, you're comfortable, you're focused, and then you can be in the moment. Because, we jokingly call the lady town, the vagina, the vulva, that is so much more able to be aroused when there's time and space. So, and when there's that little bit of pain with initial dryness, she just shuts down. She's like, why would you do this if it hurts? So we talk about this. If it's hurt in the past and there's even a twinge of pain this time, even if arousal was happening, it can just stop in a heartbeat.
Yeah. I mean, our brain's trying to do us a favor, right? It's all designed to sort of keep us alive and help us survive. And so I think that your brain can't get to the place where it's ready to be vulnerable in a state of pleasure if it's in pain, right? It's getting ready to move into the next protective state for itself. So even just, thinking about that and giving your body and brain a little bit of space. Someone left us a question.
I was laughing. Actually, It's a statement. Hey, Pam.
Oh, no.
It's amazing where these topics come up. So, maybe it's like, hey, what do you do? Oh, I take care of women with sexual health concerns. And so it's awesome
because we're talking about frat parties. Dr. Bitner, can you tell the story of you were asked to come in and give a sexual health seminar to some high schoolers? And what did you want to talk about? I love this story. This is one of my favorites.
Oh my gosh. Yeah. So I was asked by a principal at a high school to come in and talk about sexual health. And I said, sure, I can talk about STDs or, family planning all day long. I said, but I also want to make sure that we talk about that if the man has an orgasm, the woman can too. And she's like, no. You can't.
Why not? Right?
Yeah, exactly. So, maybe she was worried about hearing from the parents that was a little too risque. But, again, it's like we've got to lay this groundwork early in terms of sexual health. And because we so worry that, again, if people don't know, then do they enter into practices that maybe aren't safe, or are they having sex when they don't want to? Mm-hmm. When we do have young patients in our Empower program come in, I ask them, are you sexually active? Yes or no? Are you interested in men, women, or both? Do you have sex when you want to, or are you having sex when you might feel pressured by someone? Do you have confidence to ask for what you want? Are you in the 30% club? Are you able to have an orgasm? Do you know your anatomy? So those are all the basics that sometimes, again, we're talking to a woman who's 50 who has never thought about that. Or the story that I just love, I brought this topic up on TV a couple years ago on Fox 17, and a woman called from Kalamazoo who was 90 and had never had an orgasm, and she wanted to come into the office and talk about that. So
that's amazing.
Yeah, and she had thought that something was wrong with her whole life. Her husband had been passed for about 25 years. And she's like, orgasm? I've never had an orgasm. And so she came into the office. We did an anatomy lesson. She started vaginal estrogen. She got a vaginal dilator called Millie, which is not a sex toy, but it helped in terms of expanding the vaginal caliber. It helped relax those muscles that had been very tight from not being very mobile. She then did get a vibrator, a sex toy. And after that vaginal estrogen and being more comfortable with her anatomy, she called 6 weeks later and said, I don't need a follow-up appointment. I'm great. I've had my first orgasm. I'm good. And then I think she went down to Florida and met George, and all was better than she ever dreamed of.
Yeah.
All was well.
So you brought up Millie. I don't know if we can take some time just to talk about why you would recommend something like Millie and what you see, maybe what are the symptoms that you hear in the office and kind of what you see on exam and what would prompt you to sort of, bring that up in the office visit as a treatment plan.
Thank you. I love that. So a lot of women will come in and say, I don't want to have sex because it hurts. And I think about sexual pain with three different aspects. One is pain from the skin quality on the outside. So there might be pain because there's a skin condition called lichen sclerosis. There can be pain from low estrogen or low testosterone in the vestibule or the skin around the vagina. So we talk about that even before there's an exam. We talk about what I'm looking for. A very common cause of sexual pain is a very tight pelvic floor. So a lot of women think, I got to do my Kegels. That's the only thing that, I need to do to keep my pelvic health well. But actually, a lot of women have pelvic floors that are too tight. And to talk briefly about the pelvic floor are those muscles that line the bowl of the pelvis. And so those muscles go across the bottom so stuff doesn't fall out. There's muscles around the openings of the bladder, the vagina, the rectum. So help stuff go out when it's time and go in when it's time.
Yeah.
And then there's also the muscles that attach up the back and up the belly and down the quads and the hamstrings. So all these muscles are together. And when they're too tight, it can push on the bladder and cause bladder urgency. It can push on the rectum and cause rectal urgency. It can also cause pressure on the vagina to where it feels very tight. And women who have really high tone pelvic floor will talk about, penetration feels like searing, sharp pain. It feels like something is tearing, something is ripping. It must be dryness in the vagina. Maybe is it low estrogen? And usually it's what happens when the skin of the vagina is fine, maybe, but the muscles are so tight that the skin is pulled against the tight muscles. And if it hurts even a little bit, those muscles just squeeze tighter. So high tone pelvic floor dysfunction. If I'm rambling too much, just stop me.
Nope, that's right. I got you.
Millie is one of the tools that we recommend. So Millie, I want you to think about Millie as a massage gun for the lady town. So a massage gun you might use for tight quads or tight hamstrings. It pounds that muscle, and so it releases the tension in the muscle and the spasm. Millie is a vaginal dilator that is very, very clever. It's a genius. It's inserted into the vagina. There's a button on the handle that you push until she expands, just until it's kind of like, okay, it's just tight enough. And then even just to cover up and watch TV for 10 minutes, just to let those muscles expand. At the same time, Millie also has a vibration, probably not enough to have an orgasm, but it's to then move Millie around to get into that tight muscle, hit the vibrate, and again, it's like a massage gun.
Yeah.
At the same time,
I just want to say, I think the closest thing that women can think of having a tight muscle, a lot of times women will get tightness like in their trapezius muscles at their shoulders, and you feel back there and it really feels like a rod. Now imagine that like in your pelvic floor where the insertion site is. And just like how you would do a massage or use that massage gun, you are trying to do the same thing where you're massaging out you're mechanically moving those fibers away from each other so that the muscle can overall relax.
Exactly. Good explanation. And so as those muscles are relaxing, then again, it's then also stretching in terms of hips. So if your hips are really tight, that's just going to contract. Or, if a woman is having sex, let's say she's on her back in missionary position, knees out, pelvis pulls in. So again, the whole thing just can get contracted and tight. So it's also thinking about different sexual positions, maybe not missionary. And so it's just really knowing that those muscles, it can be a little mysterious because they're up in there. We can't see them easily. And also we recommend a lot of times for this. Let's say a woman has high tone pelvic floor. She gets a milli. We say, we're also going to recommend you see a pelvic floor physical therapist. And a pelvic floor physical therapist will do an exam first, of course, on the outside, looking at your hips and your back and your legs and how you walk and all of that. But also then they're trained to do an internal exam to actually identify which muscles are tight and how that feeds into the hips and the back. And then taking Millie with you to that appointment, they can help you direct Millie into those tight muscles. And so you can work on those muscles in between that appointment.
And, not every pelvic floor therapist needs to do an internal exam, right? So I know some women are like, ooh, no, thanks.
Right.
It can be really helpful to even just get started with a basic functional exam and just, there really are amazing experts in their field. I will say in my space, I see a lot of women with all the weight loss drugs that people are on and different dietary changes coming to see me with lots of constipation. And I cannot tell you how many women have gone to see the pelvic floor therapist and actually improve their constipation drastically. So here we were all thinking their constipation was due to maybe some of the weight loss drugs or just not enough fiber. But in reality, they had tight pelvic floor and a couple of rounds with a pelvic floor therapist. And it really has drastically improved their ability to have a good bowel movement and not get too blocked up. So
well,
just
we think about
another pitch for a pelvic floor therapist.
Awesome. But we think about constipation too, where the BMs aren't moving through the host system, but there's also obstipation. So people are going to have obstipation above that pelvic floor where the BMs are stuck above that tight pelvic floor and can't get through. But there's also obstipation with a rectocele. So a rectocele, I jokingly call a poop pocket, but it's a relaxation in the wall between the rectum and the vagina where the BM gets stuck up into that pocket. And so, number one, that can be a sexual dissatisfier if you have penetration and then pass stool. No style points for that. It's difficult, but also that obstipation of having that BM in there, it acts like a roadblock to where all the BM behind it can't come out. And so pelvic floor physical therapists can help with rectal dysfunction, bladder dysfunction, again, which can also interfere with sexual health function.
Yeah, absolutely. Now, we have another fun device that we have in our office called an O-nut. When would you recommend a woman adding an O-nut? What is an O-nut? And when would you recommend adding that into her treatment plan?
Sure. So a lot of women, as they have, they're getting better in terms of they have high tone pelvic floor dysfunction. They have a lot of pain with deep penetration. Maybe they've had surgery. They've had radiation for uterine cancer. There's a lot of not only pain, but fear of pain. So we use the treatment modalities to help get rid of the pain, but that fear can be so persistent. So if a woman's had even a little bit of pain in the past, penetration starts and immediately, again, things tighten up. And then again, thinking heterosexual, the male partner is like, oh my God, I don't want to hurt you. And there can be tears, there can be guilt. So the O-nut is wonderful to help a woman resume sexual activity without there being a fear of deep penetration. So these very soft, squishy silicone rings are put over a penis or an erect penis. And so using a lube, they slide on easily. And then these are like those teething rings, right, that our kids had, the Fisher-Price, and they stack. And so as there's more comfort, these can be taken off one by one until there's no more fear of one partner to hurt and then one partner to be hurt. And so these are just such a great tool. We say, of course, one has to have a bit of sense of humor in using all of this, but it can just be life-changing in that it just allows there to be ease. And again, what is sex? It's pleasure and it's intimacy. And if it hurts, it's hard to have pleasure.
Yeah. I think that's really interesting. Now, in our office, we are big believers also in using sexual toys, vibrators, right? So we talked a little bit about that 30% club, which means 70% of women maybe need some other stimulation or clitoral stimulation to have an orgasm. What are your thoughts about vibrators and kind of the whole sexual toy world?
I think number one, it really helps women understand their anatomy. It helps women understand where is their pleasure? How can arousal happen? How long does it take? Every woman is so different. Is there stimulation at the G spot, does that really help with arousal? Does that help with orgasm? Is there stimulation that's further down on the sides or even around the anus? Like, where is it? Is it also on the breast, on the belly? It's all those erogenous zones. And, a vibrator is a way to explore those zones and figure out what works. It's hard to ask for what you want if you don't know what you want, if you don't know what works, right?
Yeah.
It's also then to be really comfortable with, what does an orgasm feel like? What is it, again, what does it take? Are you someone who can have one orgasm and you're done? Or you have lots of them in a row, or you get to the peak and then you keep it going for a while. So again, it really helps with self-exploration, but also can be used, for example, again, with, mutual masturbation. So there's that going on both if penetration is not possible. It's just, again, to really help explore. How do you think about this here?
Yeah. I mean, one, I think people should know that the world of this has drastically changed, right? I think 10 years ago, everyone was sneaking into those like weird stores that you felt were a bit overwhelming, and like you put a hat on so no one could see you, right? That is not how it is anymore. And you kind of are left with one or two options. Oh my Lord, there are many different options, many different ways that the basically machine is stimulating. So it can either be vibrating. There's some with some high functioning, like almost like suction device, particularly for women who have had surgery or sort of damage to the clitoris to really get that tissue stimulated. There's very small vibrators. There's very large vibrators, some for penetration, some for just only clitoral stimulation. There's really a lot of different options out there now, and it's quite exciting. I mean, some of them even link into your phone that you can do like a variety of different things with. I have some patients who feel a bit shy and they're like, well, I shouldn't have to. And I'm like, how did you get here to the office? Did you drive a horse and buggy? Like, heck no, you use technology to it's 2025. Right. Like, let's use it. If we got it, and it, for the most part, they're pretty safe. Like, let's do it. Right. And I think it's just really an exciting time to be in the sexual health field, because there's just so many new tools to sort of help us along with that.
Exactly. And again, even for, couples to use this together. So again, speaking heterosexual, like men have a G spot as well. So it's finding erogenous zones. It's having ease and being playful and having fun, right? It doesn't have to be so serious. It doesn't have to be quick and done under the cover of night. Like, it's to really explore a bit. And so, some men have early ejaculation, or they have a hard time keeping an erection, or, men with ADD, just like women, like distraction comes in, and there's concern like, oh, I won't be able to finish, or they start thinking about other things where, hey, this, let's take a break. Let's get the vibrator out. Let's use it on the guy's G spot. And then things get going again. So it's just a way, again, to be playful, to have fun, just, yes, so many things. Yeah. So many things. So we sell these in the office, and we have them in a box, and we call it the box of fun. And hey, do you want to see the box of fun?
I can't say we've had anyone bring their phone in and like show us their pleasure zones yet on their phone. So if any one of our patients wants to be the first one to bring their vibrator app in for us to review, we'll be quite excited about it.
There's an app. Yeah. So again, we just really encourage that people prioritize their sexual pleasure. Again, this woman who was 90, who had never had an orgasm, when she did have an orgasm again and she was able to talk about her sexual health, she felt young, she felt vital, she felt like engaged. And so again, thank goodness she was healthy enough. Celia, I wonder if we want to segue a little bit into metabolic health. So what if this woman had diabetes or heart disease? How might that have affected her sexual health?
So just like a lot of the rest of our body, all of these sexual organs are an interplay between our nervous system and our blood supply. Anytime that our metabolic health is not up to snuff, what we think about is the beginning of blockages in the teeny tiny blood vessels that make up the blood supply to all of our organs. We think about it a lot in our eyeballs and our kidneys, but truly we should be really thinking about it at that major blood supply that gets blood and feeds oxygen to the nerves of our clitoris. And our clitoris is structured from a and anatomy standpoint, very similar to a penis in a sense that it gets engorged when blood moves in and then hangs out in this place called the corpus cavernosa, which is basically pooling of blood. And then when we activate those nerves, that's when we achieve an orgasm. So if you're in a position where your blood sugars are not where they should be, right? Maybe you're struggling with some other aspects of vascular disease, which is either peripheral vascular disease, you're high risk for having a stroke or heart attack, kind of making sure that we're doing everything we can, not just to prevent those life-changing things, but also to preserve your sexual health. Honestly, a lot of the times that's how we get guys going on new medications and dietary changes, because we're like, if we keep going down this pathway, your penis may not work. Women should be just as excited about having their clitoris work as long as possible. And that may be a driver to maybe starting a new medication, really diving deep into a dietary change, something that you find that you can stick with and kind of finding the balance, if anything, just to kind of preserve that vascular and nerve structure of these sexual organs.
Right. And, there's not a lot of research, right? In men's health, there's a ton of research on cardiovascular disease. I think I saw a study on the CAC relating to erectile function. Yeah. But with women, it's a little bit more difficult. There are actually studies looking at blood vessel flow in the clitoris. It's looking at those small vessels. It's using an ultrasound Doppler to look at this. And there's just not a lot of research that's been done yet that's vigorous, that looks at actually relationship of small artery disease and sexual function. But it sure goes to follow that the same would be for both men and women.
And I think some of the reason why that may be is because for a long time, we didn't have great treatment plans for, something like type 2 diabetes, right? Forever, we were just kind of giving people more and more insulin, and us doctors were just kind of watching the numbers go up and up and up. Obviously within the transformation with that space has been huge in terms of correcting people's blood sugars with some of the newer medications that have come out over the past 5 to 10 years. And I would not be surprised if we see some correlation with improvement of blood sugars from these newer agents that are really truly legit and improve sexual function or prolong sexual function, kind of later in life, because we've been able to preserve that overall metabolic function, which would be quite exciting.
Yeah. And the more that I think we can talk about sexual health, that it's okay to still want to have sex at 60 in menopause, right? And so it's, one of those things that, if there's any distress, once it's brought up, once we talk about it, again, that can be a reason to say, let's work up our risk for heart disease. And so how can we preserve that vessel function, going forward?
Yeah. All right. Should we move on to is it 5 take-home tips first? I think.
Should be, or 5 questions for healthcare providers.
5 questions for.
So we always talk about, if you're not able to see us at True and you're seeing another provider, we want to make sure you have questions to take with you to that visit. So this is always my favorite. I think it applies to everything, is asking your provider, what is my phase of ovarian function? We talk about there's reproductive phase, when women are having regular periods and their hormones are, unless they're on a birth control pill, their estrogen is in normal range. It goes up and down over the month, but overall in a good place. Their testosterone levels are good. Progesterone levels are good. In reproductive phase, of course, the only thing that really changes is when a woman is postpartum after a baby. Estrogen levels can look like a woman who's in menopause. So that's certainly something to look at in terms of sexual function with desire and arousal and orgasm. Or are you in perimenopause, late or early? And that can also affect sexual desire, arousal, orgasm. And then also 3 is menopause. Are you in early menopause or late menopause? So again, it's really important to know what phase you're in and how, and then the next question is, how does that affect my sexual function?
I think too, this is such an important question, even from, I'm an internist, my point of view is when a woman comes in and maybe they're saying their menstrual cycles are off, if I don't know what her phase of ovarian function is, then I don't know how to proceed forward, right? So if I don't know if they're in menopause or not, if they're not in menopause, then I need to look for another reason for why their menstrual cycles are not coming on cue versus being in menopause, which that would be a normal aspect of aging. So again, it's really imperative that any provider that you're working with has a general sense of where you're at in terms of your phase of ovarian function.
Right. We think about like reproductive phase with irregular periods. Do they have polycystic? Do they have insulin resistance?
Yeah.
All those things, right?
Yeah.
Yeah. So it's a lot. So important to know.
Number 2.
Are you comfortable? Go ahead.
Are you comfortable talking about my sexual health? And what is your training? At the very least, they should be comfortable, I would say.
Right. And again, all the respect, right? It's hard to be comfortable if you haven't had that training. And I tell you what, med school is not a place where we got, I think at my med school at Wayne State, we got like 10 hours of, it was a full day of lectures. That was kind of it. And it was more of a desensitization more than it was a lecture and teachings around sexual health. I don't know, Celia, what your training was.
I wouldn't say I got a tremendous amount in medical school. I did get a good amount in residency, which I went to residency in New York, where they're pretty open-minded about that kind of stuff, and they really push a lot of things. So I did get probably more than the average internal medicine resident, but
you probably got more than the average OB resident. So I'm an OBGYN, right? Yes, we didn't get training. And really, yes, I trained in Grand Rapids, but I wouldn't say it's different than a lot of my colleagues. So unfortunately, there's a paucity of training. So, if your provider is not comfortable talking about it, it's really important that they acknowledge that they're not comfortable talking, and at least to acknowledge, hey, your concern is real. Sorry about that. Your concern is real, but yet it's not something I'm comfortable talking about. I'm going to refer you to one of my colleagues.
Yeah.
And have they had any training?
I think it's really important to make sure that someone doesn't bring in their own personal experience. We've heard this a lot from women that will say, oh, I was talking to my doctor and they said, well, you know what, my wife doesn't have any sexual problems, so like that's not a big deal. Or, my grandmother never went through, or my mom never went through any aspects of this, so like who cares, right? Like you really do want someone that's a bit open-minded at least, and can bring in more evidence to help kind of with your complaints about menopause or sexual health.
100%. And there is, again, a website or a group called the International Society for the Study of Women's Sexual Health. It's ISWISH. So you can actually go to the ISWISH website. There is a list of providers that are either members of ISWISH or fellows of ISWISH. And there's a new website by ISWISH that I'm a part of that's building this, called ProSayla, PROSAYLA, prosayla.com. So there's a lot of information that is available for you. So hopefully your provider has been to ISWISH and knows what that is.
Okay. Number 3, can I get a referral to a pelvic floor specialist? I think we talked a lot about pelvic floor specialists and how important they are, particularly if you're having pain with intercourse, constipation, incontinence, a variety of different things.
Yes. And again, they're certified to do an internal exam. So it's okay to ask, what is their certification? What is their level of training, to really know that you're in the right spot?
And just to be clear, most of them are women. I actually don't know if I've ever met a male pelvic floor therapist. Yeah, just to ease everyone's comfort in case you're wondering.
Yes. Yeah. All right. Number 4, is my vaginal dryness due to a medical problem? So again, reflecting back on what we talked about earlier, vaginal dryness can be due to fear of pain. It can be because of prior sexual abuse or emotional abuse. It can be for lots of reasons, not necessarily a medical problem. It can be because of being postpartum and having low estrogen levels, or in menopause, low estrogen. So again, it's so important, if you have vaginal dryness, to ask your provider, is this due to a medical problem?
And if all the medical problems are ruled out, it may be something silly like, putting your kids to bed a little bit earlier, right? Just to give yourself a little bit more of that time to kind of get in that arousal state. And maybe those are some of your barriers to being fully aroused and ready to go when you want to be.
Perfect. And number 5,
are any of my medications causing sexual side effects? So there are some medicines that can cause sexual side effects. Some of them can be related in the mood arena. Some of them can be some of the bigger gun medications that we use for like autoimmune disease at times. So, it's always worth a conversation if you start a new medication and you've seen that your sexual health has sort of changed or your libido's changed, to have that conversation with your doctor.
And there's even a sexual health condition called PGAD, which is persistent genital arousal disorder. It's very rare. I've seen 2 women with PGAD, and that can happen because of withdrawal of SSRIs. So again, it's knowing that medications can cause sexual health concerns. So it's really making sure you're seeing someone or being referred to someone who might know more about this.
Okay. Now our 5 take-home tips.
Number 1, tell yourself, I am worthy. So sexual health is a part of being human. And if this is something that you're interested in, know that you are worthy of having sexual health or a healthy sexual life, if that's what you want, in a way that's safe, it's vulnerable, it's when you want, it's how you want, it's if you want. This isn't something that you do because someone else wants you to. It's because you are worthy to have what you want.
That's awesome. So exciting.
Yes.
Take some time to reflect on what you want. So again, women, we know, we hear it every day. Women are doing so many things for so many other people, for work and kids and other family members. Even just, grabbing, even if you're not a patient of ours, grabbing Dr. Bitner's, workbook, jotting some ideas down of what you want, what we call your picture of self to be in terms of your sexual health. Like, do you want to be having sex to your 90? Do you want to, are you going to be fine when you're 60? Like, there is no wrong answer as to what that looks like.
Perfect. Educate yourself on your body. Again, many women come into the office and they're 50 or 60 and there's pain with sex, or there's vaginal dryness, or there's a lot of itching down there that might be a sign of a condition called lichen sclerosis. And, we get out the mirror. I had a patient the other day. She's like, oh, I heard about the mirror. And so the mirror comes out and they're like, oh my God, I've never looked down there. I don't know what my parts are. And so it's just enlightening to say, so it's okay to get a mirror out. It's okay to take a look down there and see, again, what's what. We've done a lot of talks on the anatomy. We can certainly address that again. It's understanding. And again, it's not just about the genitals, right? It's about what are those other parts of your body that are sexually exciting to you? What turn you on? So again, it's just educating yourself about what's going on.
Yep. Another pitch for sex toys. Just get it out there. If you're on the fence, just buy one. You probably won't regret it. I don't know if we can get shipping before Valentine's Day, though. It's only 2 days away.
You might have to come into the office.
Yeah.
Number 4, check out the sex deck. So again, in the chat, you can see how to get the sex deck. The sex deck is just, again, it's a great way to have a conversation with yourself to understand why you might have low desire. It's a way to have a conversation with your partner, with your provider. If you're not here in town or not seeing us at True, it's just a really great way to understand. And, for those of you providers who are listening, this is a great way for you to get comfortable talking about sex. I wish this were in the pocket of every provider across the country, because again, it's a way to guide this conversation and, again, to take the mystery out of it or to take any shame away from it. It is a thing. Now, here's the interesting thing. Let's say that you go through the sex deck and none of the cards apply to you. Your relationship's great. You're feeling great. You are healthy. You are well. There's no issues.
You downloaded all the erotica. There's nothing left.
That's it. And you just don't feel anything. You don't want to have sex. Then what that means is that's a way to diagnose what's called hypoactive sexual desire disorder, or HSDD. HSDD, it's a definable condition. It's in the DSM-5. It's a true, or is it DSM-7? It's in the DSM, which is the Diagnostic Manual for Psychological Health. It's a real thing. So HSDD is when there's a switch in the brain that just gets flipped off. We don't always know why. The great thing about then having that diagnosis and having that diagnosis is there are 2 FDA-approved medications for HSDD. One is called Vyleesi. We jokingly call it the horny shot. It's a shot that's given sub-Q. 45 minutes later, spontaneous and responsive desire is generally very high. One of the downsides is that it can last for 12 hours. We've had patients who have called and said, oh my God, I don't have time for 12 hours of sex. But hey, now and then it might just work fine. The other drug that's available is called Addyi. Addyi is a drug that's a distant cousin, let's say, of a Lexapro or a Prozac. It was studied for depression, didn't work for depression, but women who took it were horny. So, if it works in 2 months for you and increases your desire, it helps you want again, Addyi can be a really good option. So again, please talk to us about these if you think this might apply. Now, I see a question from Michelle, or a statement. Pulled out your book again, Diana. Oh, thank you so much. Again, it's just we want to empower women that you can have the health and the future that you want, just like you can hopefully have the sexual health that you want. You really deserve this. So the book is actually the story of the pilot study. So back in 2008, we did a pilot study of waypoints that we discussed earlier. And it's the stories of the women who went through the pilot study, what they learned, what we learned about doing the pilot study, and how this can help many women. So really appreciate that, Michelle. Thank you. Number 5.
Okay, be proactive about seeking out solutions. Find a therapist, maybe find a couples therapist. Maybe a pelvic floor therapist is what you need. Maybe you need to talk to someone about getting your metabolic health back in line, or maybe changing up some of your medications. As always, there's always a conversation about whether or not, if you're someone who's in that perimenopause, menopausal timeframe, whether menopausal hormonal therapy is right for you. There's a lot of different things that are out there now that are available. Taking some time to reflect on where you want to go, what your barriers are, and then send some feelers out to either your physician, or you can reach out to us at, truewomenshealth.com, either become one of, come and work with us, or we've been continually trying to make new avenues for patients to collect information. So we have something called Mighty Networks, which is available, that if someone's like, look, I'm not from the state of Michigan or any of the states that you work in, and I just want some information more about menopause and metabolic health and sexual health, that is just a quick and easy way to gather some information and kind of work through the different steps that we would work through in the office. So that's a great way for those folks that can't come and see us.
Exactly. And again, just to have some structure around this, again, is why we created the category X in waypoints. So again, as we go through this process, again, we're going to ask you, what are your goals? Where do you want to be? Where are you in terms of your sexual health? And what are the barriers? And once we determine those barriers, then we can go down the checklist of options. So again, know that you're worthy. Good sexual health is very possible. And we just wish you all the best, and we want to reach as many women as possible.
Yes. Everyone have a great Valentine's Day with that in mind.
Yes.
Maybe carving out some time.
Exactly. Awesome. Great.
All right.
So, fun to talk to you. Have a good night.